about it, isn't it great?
Thank you, Sonal, and good evening. I'm here to impart three messages, really. One is that where we work in the Middle Hills of the Himalaya, it's pretty tough. And that's the first message. The second message is we're very good at what we do. And the third message is to ask you to join us in helping us to do more. So here goes. FAISE is committed to improving the lives of some of the most disadvantaged people in our world. We are currently working in remote villages in the Nepalese Himalaya, where life is truly harsh. It's a landlocked country sandwiched between India and China, and it's most famous for Mount Everest. We work in 3 districts, all remote, one taking 5 days to walk in from the nearest road to the village, and another, Gorkha, is famous for the supply of Gurkha soldiers to the British Army. When we think of Nepal, most of us think of trekking holidays, magnificent views, and wonderful scenery. But the reality for the 70% of Nepalese people who live on or below the poverty line is quite different. For example, malnutrition is not uncommon. Could you imagine living with no electricity, no water, no toilets, no running water, no toilets, no healthcare, and like these children, little if any opportunity of education? You seem to not be syncing with the...
It's not working.
It's not working.
It's going off in the same way.
Oh, right, okay. You have to bear with us, I'm sorry about this. In this environment, everybody has to work to stay alive. The girls you saw earlier were carrying heavy loads of grain. There they are. And if they were lucky enough to go to school, they'd have to do those manual chores before they set off on an hour or two's journey to their school. Surviving day to day means hard physical labour. It doesn't matter about your age, gender, or whether you've recently given birth. And if that wasn't enough, the terrain and the lack of roads means that everything is transported on the backs of humans or animals. Loads as heavy as 80 kilos are carried by men. We saw those men just there. Here they are, climbing steep mountain tracks with barefoot often, at best with flip-flops. Although our projects primarily deliver healthcare, we also deliver programs aimed at poverty reduction, like improving animal husbandry and horticulture, and we work in the field of education as well. Whatever we undertake, we do it at the request and with the involvement of the communities with which we work. This is exceptionally important because this provides ownership, dignity, and hence sustainability. Our health programs start with basic hygiene, the provision of toilets, and the supply of clean water. We run 8 rural health posts and employ 25 Nepalese staff. Our nurses are all female, young, and very brave. They live away from their families in difficult conditions, are on 24-hour call, and in this male-dominated society act as inspirational role models for other females. Their training enables them to effectively act as GPs, dentists, pharmacists, and midwives. I'm looking for this guy, yeah. Had we started FAISE 5 years earlier, then this guy probably wouldn't be in the state he's in today. And a simple thing like breaking a leg can render somebody unable to work and not be able to look after himself or his family. Some facts and figures. We've been established for 5 years, and at this time we've seen nearly 150,000 patients, remarkably at a cost of less than £1.30 per visit. We have an assisted childbirth programme, and whereas Nepal's national average of assisted births is 19%, and in remote rural areas 0, in the remote areas covered by our nursing staff we have achieved 27%, and this is rising. and as a consequence for saving many, many lives. And what do the villagers say about us? This lady, Maya Tamang, lived with uterine prolapse, a condition that hampered her social acceptability and life for many years. She says, Faye's nurses changed my life, and you know, it cost 70 pence. Sunita Shrestha says, Faye's health workers saved my baby. Our nurse rehydrated that child after a severe bout of diarrhea, saved a life, and it cost 40p. Other charities working in Nepal hold Faye's in high regard. Hidayah Dev Kota and Mesh Chowdhury from the Child Welfare Scheme UK say all Faye staff are good, motivated and committed. In fact, we're so well regarded that the local government in Gorkha have asked us to partner with them to expand our work there. I hope that in the brief time allowed I've been able to give you a bit of a feel about what we're doing. I'm extremely proud of what we've achieved. Virtually every penny raised is spent in our projects. Faye's is run like a successful business. It plans well and concentrates on efficient economic outputs which are regularly measured. And this is my last message. Now is where you come in, because we're asking you to even support our work by providing resources to pay for a second senior health worker to travel around the Faye's projects, supervising nurses and ensuring that we have the training and support they need. And of course, we're delighted if you choose to do more, as there's much to do. And I can absolutely assure you that any money provided this evening will go entirely to our projects. By helping us, you'll be putting smiles on children's faces and assist us to continue and expand the work we are so proud of. I'm passionate about the work we do, and I'm continually amazed at how much we can do for the little money we spend. Our work is transformational, and I invite you to join us. Thank you. I'm very sorry.